Miriam Cates.
Madam Deputy Speaker, we are facing a crisis in children's mental health, and many members have outlined that very articulately in this debate. I do welcome the Government's Mental Health Recovery Action Plan. But if we are serious about tackling this tragedy, and it really is a tragedy, then we have to look at the root causes. Firstly, COVID-19, or indeed our response to it, has been a disaster for children's mental health. And despite knowing very early on that COVID posed almost no risk to children, we closed schools for months at a time, and our children missed more face-to-face learning than almost any other country in Europe. But COVID measures haven't been the only political threat to children's well-being. Over recent years, we've seen the increasing politicisation of children in schools. And parents across England frequently write to me about extreme gender ideology and other radical ideologies being taught in schools and reinforced by the internet. When gender non-conforming or autistic or same-sex attracted or troubled children are being told by trusted adults that their problems can be solved by changing sex, then we have a serious safeguarding and well-being issue. The rise of the internet, particularly social media, presents a serious threat to our children's mental health. There's a huge piece of work to do to keep children safe online, and tech companies must step up. Family breakdown is a threat to children's well-being, and 11 to 16s who live with a lone parent are twice as likely to be diagnosed with a mental disorder than those who live with both parents. It's no surprise that our children are facing a crisis of mental health when we have one of the highest family breakdown rates in the Western world. And in recent decades, our social policies have made family life progressively more expensive, more stressful, more and more parents pushed into full-time work with less time and energy to devote to nurturing children. And I pay tribute to my right honourable friend, the member for South Northamptonshire, for her amazing work in delivering the Start for Life offer that will strengthen families. But there is more to do. And we need to start by recognising that intervention through schools and through the NHS, as important as that is no substitute for strong families, where children have the opportunity to develop virtues, character traits that will give them the best chance of good, lifelong mental health. We have to pursue policies that strengthen families, equip parents and communities to foster in their children the values and virtues like patience, resilience, perseverance, self-control, humility. These are the kind of virtues that are not only taught in school, but also taught in families and communities, and build the foundation for fulfilling and happy adult lives. As the old proverb says, train up a child in the way he should go, and when he is old, he will not depart from it.